Good afternoon, and thank you all for joining us today for the Rate and Quality Advisory Panel meeting. We will begin the meeting shortly, but first we would like to provide some information about translation. In order to provide language access, this meeting will have simultaneous bidirectional interpretation from English to Spanish, English to Mandarin, and ASL. Please note that the translation globe will not appear until all of our interpreters have shared language instructions. We are asking that everyone joining us for this event, please select your preferred language to facilitate hearing participants and presenters clearly. If you're on your laptop, please locate the icon shaped like a globe at the bottom of your screen and click the language interpretation and select English if this is your preferred language. This will enable you to hear interpreters who are translating participant comments from other languages into English. If you're on an iPad, phone, or similar device, you will locate the three-dot menu in the right corner of your screen, click on language interpretation, and then select English when that option becomes available. A reminder to us all, when you speak, please do so at a moderate pace because our interpreters are going to be simultaneously interpreting everything we say.
Buenas tardes a todos y bienvenidos a esta reunión. Diana Orozco y yo, Giovanna Wormsbecker, seremos sus intérpretes en español. Esta reunión contará con interpretación simultánea bidireccional en inglés y en español y mandarín. El globo de traducción no va a aparecer hasta que yo haya leído las instrucciones en inglés, español y mandarín. Por lo tanto, pedimos que todos los presentes seleccionen su idioma preferido para facilitar escuchar a los presentadores y los participantes con claridad, evitando que se produzcan fallas técnicas o interferencias entre los tres canales lingüísticos cuando no se ha seleccionado uno de estos. Si está usando una computadora, verá un icono en la parte inferior de su pantalla a la derecha en forma de globo que dice Interpretación. Haga clic y seleccione Español. Si está usando un iPad o teléfono, localice el menú de 3 puntos que aparece arriba a la derecha, haga clic en Interpretación de idiomas y elija Español. Cuando sea su turno de hablar, por favor recuerde hablar con voz fuerte y clara y a un paso moderado, ya que la intérprete estará interpretando simultáneamente al otro idioma. Now I will turn things over to our Mandarin interpreter. Thank you.
大家下午好，欢迎参加今天的会议。我的名字是亚楠，和康宁一起提供普通话的翻译。为了提供语言服务，今天的会议我们提供从英语翻译为西班牙语、普通话和手语的双向同声传译。请注意，在我们读完所有英文、西班牙文、中文还有手语的说明之后，翻译频道的地球图案才会出现。为了避免有人未选择语言频道导致技术性的故障或回音的干扰，我们要求今天参加会议的每一个人都请从3种语言当中选择您想听的语言，以便能够清楚地听到发言者和与会者的声音。如果用英语听取，也请您选择英语的频道。如果您使用的是台式桌面或笔记本电脑，等一下您会在屏幕底下看到一个地球形状的图标，点击之后开启语言翻译 Interpretation 的功能，然后选择英语或是普通话，就是 Mandarin 的频道。如果您使用的是 iPad 手机或类似的平板设备，等一下在屏幕右上角看到3点，点击语言翻译的功能 Interpretation，然后可以从选单里选择英语或者是普通话，就是 Mandarin 的频道。如果今天有机会让您发言，请您放慢速度，让我们口译员能够同步翻译您所说的所有内容。谢谢。Next slide, please.
Thank you so much. We are now enabling interpretation. Please identify the globe icon and select your preferred language. We are ready to start the meeting.
So good afternoon, everyone, and welcome to our Rate and Quality Advisory Panel meeting. Thank you for taking the time to join us. I am Dr. Lupe Jaime Milam, Deputy Director for the Child Care and Development Division at California Department of Social Services. At the last Rate Quality Advisory Panel meeting on April 8th, we presented and took feedback on the defined elements of the base and the enhancement rates for family childcare home providers. The definitions were agreed upon by the Joint Labor Management Committee, according to an agreement between the State of California and the Child Care Provider United CCPU, as codified in legislation. As a reminder, the JLMC definition document is available on the CDSS Rate Reform and Quality website. We will post the link to the website on the chat. The JLMC met on numerous occasions between October of 2023 and March of 2024. Its discussions were informed by substantial data collection and constituent engagement, such as prior convenings of the Rate and Quality Work Group in 2022, and over dozens of public meetings were held in 2022, as well as meetings in the JLMC, resulting in the community-informed recommendations by both parties. Public engagement and data collection activities by state contractors, prenatal to 5 fiscal strategies, which is P5, from July through October of 2023. P5 worked and formed to develop the development of California's 2024 cost estimation model. The full universe of California's childcare providers and programs were represented in these activities. An online survey, interviews, and over 100 virtual input sessions yield feedback from over 10,000 providers. Focus groups were held on special topics, including California state preschool programs, family childcare home educational networks, multilingual learners, children experiencing delays and disabilities, and child care and care during non-traditional hours, geographical considerations, and migrant programs, as well as child welfare. Meeting of the Rate and Quality Advisory Panel and the Early Childhood Policy Council. Has been 1 year since the Rate Quality Advisory Panel was reconvened. And that year, there has been numerous meetings that has occurred. The Early Childhood Policy Council has met quarterly during this period of time. Both have provided an opportunity for communication about input on rate reform. Our legislative partners have also assisted in supporting the alternative methodology process with the public engagement. Senate Budget and Fiscal Review Committee Committee 3 on Health and Human Services also held multiple public hearings on rate reform. We look forward to continuing the rate reform conversation today, but today we'll have the focus on center base. We will be sharing our plans for ongoing community engagement for fiscal year 24-25 towards the end of the meeting. Last meeting at the Rate and Quality Advisory Panel, we also provided shared information about 2 submission of information that the state will submit to the federal ACF by July 1st of 2024. These are the CCDF state plan for fiscal year 25 through 27, and a letter requesting an exercise federal flexibility made available to states such as California, who were transforming from a market survey to an alternative methodology. Today, we will be sharing one component of the federal flexibility submission, which is an inflation analysis, with you in great detail. So let's look at the agenda and let's go to the next slide. Okay, so here's the agenda for today. After my opening remarks, we will move into a presentation and panel discussion of definitions of elements of the base and enhancement rates for centers. And then for item 3 on the agenda is the presentation from the partners of P5 on the recent analysis they conducted to see whether or how our current regional market rates have kept with inflation. Our final agenda item is to recognize the contributions of the Rate and Quality Advisory Panel during this significant time, and also continue to preview next steps for the rate reform process. So let's go to the next slide. Thank you. We'll now move on into our discussion of the base and enhancement rate element definitions for the center-based programs. But first, I would like to offer 3 reminders. First, the state and CCPU met over many months to arrive to a consensus on the definitions for family childcare home providers. As mentioned, last month's meeting was devoted for the input on the definitions for family childcare home providers. So we respectfully will request that the feedback for today's is centered on the centers. And then second, I would like again to underscore that defining the elements of rates that will be part of the new single rate structure is a policy setting process. We are not yet at the rate setting process. While the 2 things are interrelated, it will be helpful to keep in mind that we are discussing today is the structure of our future system and the kind of costs that will be addressed through it, and not how much providers will be reimbursed or the administration of reimbursing the rates. Those conversations will be coming in the near future. And then finally, as we shared last month, the authority to establish based and enhancement rate definitions and set rates does not sit with the panel. However, the state values, compiles, reviews, and makes use of all discussion, all public comments, whether it's verbal in these settings or other settings, as well as through our mailbox or the many ways that you communicate with us, will continue to be part of our information that we receive. Panelists, community members, expertise, and the feedback matters to the decisions that are made are critical for your feedback. Let's go to the next slide. Okay, so Article 7.3 of the successor agreement between the state and CCPU created a system structured review of the Joint Labor Management Committee and charged it with using information from the cost estimation model to define the elements of the base rate and any enhanced rates to inform the state's proposed single rate structure, and rates to be subject to the mandated public engagement of the state plan process. In March, the JLMC defined elements. We reviewed the definitions for the family childcare home providers in detail during last month's meeting. The definitions are the starting point for defining rate elements for centers as well. However, regulatory and programmatic considerations that apply to centers are different than those that are applied for family childcare home programs. The data collected by P5 and the cost estimation model that P5 has built reflect material differences between the cost of cares from centers and family childcare home providers. The defined elements of the base and the enhancement rates for centers should reflect those differences. Public comment at today's meeting will inform the state's definitions for the base and the enhancement rates elements for centers. The state also recognizes that these topics require more discussion, so today will not be enough. Last week, CDSS, in partnership with CDE, convened a center focus group comprised of center-based programs, including Title 22, private centers that participate in the state voucher program, and Title 5, Child Care and Development, and state preschool programs. I think I said last week, but I believe it was this week. Professional associations and advocacy organizations that represent centers were also invited to participate. The center focus group will meet as needed through the end of fiscal year 24-25 and will be advisory in nature. Its purpose will be to elevate particular costs and considerations for centers and the alternative methodology process. This opportunity for center input is part of the public engagement state plan process for based and enhancement rate definitions. As we have all along, CDSS will continue to collaborate with our state partners, California Department of Education, with an aim to ensure maximum alignment between state preschools and childcare development programs. And finally, we created a dedicated email address to which members of the public may send comments on the rate element definitions until May 23rd of 2024. The public may also use this address for questions about the alternative methodology process. That address that we will put in the chat will be posted there for everyone to look at. And it's single rate structure at dss.ca.gov. Okay, let's go to the next slide. So we shared this slide last month. So just a quick reminder that the base rates is the foundational rates before any differentials are added, meant to ensure that minimum health and safety and staffing requirements are covered, and to determine compliance with the federal equal access requirement. The JLMC base rate elements are organized into 5 grouping bullets at the bottom of the slide. Next slide. I want to take a moment to clarify our understanding of the distinction between rate elements. Sorry about that. Points. And selection point is the choice of a particular value that has been made for each variable that is included as an element of the rate. So let's talk about an example. The professional development variable is defined as the number of paid training hours. The actual number of paid training hours used as an input to the cost model is the selection point. While the JLMC was charged with defining the rate elements, the selection point values were outside of the scope of what the JLMC was charged with recommending. Where you see TBD indicated in some of the rate element definitions, this is a placeholder for the selection point. Selection points will be negotiated between CCPU and the state concurrent with the rate setting. Input from centers, programs, and other community input will be gathered through a parallel process of public engagement. Okay, let's go to the next slide. So now we'll jump in here. So we're ready to dive into the definitions. In some cases, the definitions for centers are currently identical to what the JLMC landed for family childcare home provider, which we presented last month. And others, they're different. I will flag this as we go through them. My goal is to go through them. After I go through them, then I will also have P5 jump in because we did receive some critical feedback that we want to make sure that we also address. Once we've addressed that, then we will open it up for the panelists to ask questions. We'll be more than happy to go back to a slide, as well as provide us feedback. And then we will then open it up for the public to also provide us questions too, or public feedback too. So with that, then we will start by reviewing the definitions of rate and group size. So both for Title 22 and Title 5 centers, the staffing ratios and group sizes you see here on the slide are non-discretionary. That means that they respond to regulatory standards that can't easily be changed. As we are all aware, those regulatory standards are different from centers and family childcare home providers. So the substance of the element definition is a little different on this. Okay, so let's go to the next slide. So the next element consists of staffing patterns. So for centers, the teaching and non-teaching staffing patterns is derived by either Title 22 or Title 5, and group size and number and age of children. The JLMC approved the definition of staffing patterns is different from centers than from family childcare home providers and recognition of the different regulatory requirements. While the staffing pattern for centers is not set in regulations, the regs for Title V, the funding terms and conditions require programs to complete certain tasks that relate to a broader agreed upon number of hours, a specified work depending on student population, and by extension require the estimated FTE needed for each description. So for teacher staff, the model includes a lead teacher as well as supports for the lead teacher in the form of an additional 2-point FTE assistant teacher each week to assist with ratio requirements. The 0.2 FTE is the number required to allow for coverage throughout the 10 hours a day while still maintaining ratio. The 0.2 FTE is used nationally in other states that use a cost model. For the non-teaching staff in both Title 22 and Title 5 centers, the definition is as you see on the slide. ECE Program Director, which is 0.5 FTE for up to 50 children, 1 FTE if between 51 to 150 children, 1.5 FTE if 151 to 250 children, and 2 FTEs if over 250 children. The EC supervisor or assistant director is 1 FTE per 94 children. Financial manager is 0.25 FTE for 31 to 60 children, or 1 FTE per 60 children. And then the admin assistant, 0.5 FTE if less than 60 children, or 1 FTE per 60 children. So let's go to the next slide. The next grouping, we will review the compensation. Let's look at the element for wage, salary, and income. The LMC defines compensation for Title 22 and Title 5 settings as shown on the slides. So the model can be run using various combinations of the sources of the following sources depending on the selection point, which has not yet been determined. So what the selection points are: Bureau of Labor Statistics, BLS of 2023, MIT Living Wage Calculator for California 2023 with family compensation adjustments, a hybrid of BLS approach that adjusts for BLS wage upward by a percentage that varies by geographical region, using the MIT Living Wage Calculator to inform that adjustment. A regional difference factor may be considered that varies by geographical regions. Additionally, for Title V centers, the salary scale will be adjusted some percentage higher than Title 22 salaries. The percentage is TBD. So let's go to the next slide. Now we'll turn it over to Gina.
Thank you. Good afternoon, everyone. So I'm just going to unpack a little bit more around this concept of a hybrid BLS plus approach. So as Dr. Jaime Mayam just said, the floor for a BLS has been compared to living wage. So I want to start from that vantage point to unpack this a little bit. But before we move to unpacking how we can approach building a BLS plus, just want to share some of the details of BLS values for the state of California. As we've talked about before, there is one position in the BLS that is referenced as directly a childcare worker position. That position's value for the statewide California value in the BLS is $18 an hour. There is a range across the other regions of the state, because within the state, the BLS does slice the state into several different regions, and that range is from just over $17 an hour to $20 an hour. So there is a small range in what BLS gives us for that childcare worker position. Then it varies across the different geographic regions of the state. What I want to do next is talk about how the approach to thinking about a plus to the BLS has been done. And so let's go to the next slide. As we mentioned on that previous slide, where we were going through the compensation choices in the model, the consideration of a BLS plus has taken a BLS value for a given region of the state and then compared that and looked at the differential between that BLS value and the living wage for that area of the state. So what this allows us to understand is how far the BLS value is from a living wage value for the given location. It supports the establishment of the lowest salary point, the starting position in a salary scale, but again is comparing that position to then what the living wage needs to be for that area. That position in the salary scale is the assistant teacher or the floater in a family childcare or in a center-based program. So that's the start of a salary scale. Other positions in the program are higher than that floor that's being established based on additional requirements of the positions, like lead teacher compared to an assistant, and additional requirements or responsibilities of an assistant director and director positions or a family childcare owner, acknowledging that those positions do have more responsibilities and more expectations or qualifications that are required of them to be hired in or to have that role as a family childcare owner. What this also gives, as far as an opportunity to understand regional differences in the cost of living in California, is that there is living wage value information across the state, and we can, using that comparison of BLS to what the living wage is, then account for regional differences in the cost of living as well, and using all coming from that basis of plussing up the BLS towards living wage. So the chart here on the slide offers just a couple of examples of what these salary points could be. So these are example starting points. There's only two positions shown here, the assistant teacher and the lead teacher. We're not showing the whole salary scale, just showing those two sort of core positions in center-based programs. And so with these two position types in mind, we're showing kind of the high end possibilities and the low end of the BLS plus approach. So starting at 20 for the assistant teacher under the BLS plus, you see where the lead teacher position would come in as an hourly value. Of course, the assumption is that this is a full-time, full-year position. And then the high end, thinking about the living wage needs across the state, is that second column off to the right at $29.28 an hour for an assistant teacher. And when that is the BLS plus floor for the salary scale, the lead teacher then in this example would be coming in at $40.58 an hour. So this gives you a sense of how the BLS plus is seeking to adjust up the BLS considering living wage as part of it. So again, these selection points are still to be determined, but these give you some examples of how the dollars and the outputs from the BLS are being utilized to think about a BLS plus approach for the salary scales. And I'll turn it back to Dr. Lupe.
Thank you, Gina. And once I get through the next couple slides, like I've mentioned, we'll pause because I'm sure there will be some questions in regards to those particular slides too. So let's jump now to compensation. So here we will look at mandatory expenditures related to staffing and discretionary benefits. So the definition of mandatory expenses relates to staffing for all categories of providers, family childcare homes and center-based, is non-discretionary and consists of the FICA Social Security of 6.2%, the Medicare at 1.45%, unemployment insurance at 3%, workers' compensation at 6%. there are two types of discretionary benefits. That is the paid time off and the employer shared of the health coverage. For discretionary benefits, paid time off, the definitions is hours of paid time off for each staff, with the number being reflected currently at TBD. And then for the discretionary benefits, the employer share of the health coverage contribution, the definition of the dollars amount per staff position with also being referenced as TBD. Okay, so let's go to the next slide. So let's transition to the professional development supports here. And here you'll see the definition for training and planning time. So first, training. For both Title 22 and Title 5 centers, the definition is hours annually per staff person, with the number showing TBD. And for Title 5 centers, the numbers of hours will be higher than those of Title 22 centers based on the additional Title 5 regulatory requirements. So now let's look at the definition of the planning time, which is the same for all providers. The element is defined as hours of planning time per week, with the number of hours referencing as TBD. So let's go to the next slide. So the next two slides, we will look at the quality variable grouping, and specifically the definition for family engagement and the child education and development, as well as child health, inclusion supports, and then the dual language learners supports. So family engagement for both Title 22 and Title 5 centers, the definition is the same as the family childcare homes. Number of hours per child per year to support required and expected family engagement activities, including but not limited to conferences and conference equivalents. The actual number of hours is TBD. The child education and development for that, for both Title 22 and Title 5 centers, the definition is a flat amount per child annually plus a flat amount per classroom. The amount is TBD. This is the same as the FCCs, except that for FCCs, the flat amount is applied per home. And then child health. For license exempt FFN providers, the JLMC did not include child health as a rate element since there is no licensing or regulatory requirement. For both Title 22 and Title 5 centers, the definition is the same as FCC, a flat amount per child annually in addition to what is included in a non-personnel, and the amount is going to be TBD. Okay, so let's go to the next slide. And in this slide, we will cover the definition of inclusion supports and dual language supports. So inclusion supports for both Title 22 and Title 5 centers, the definition is the same as FCCs. The definition has three parts. It has equipment and special materials set at a fixed amount per child per year, which is TBD. Hours, meaning a fixed number of hours per week per child, which are also labeled as TBD, and the number of children to whom this applies, which is also a selection point, which is TBD. Now, the next one is dual language learner support. So for all centers and FCCs, providers and definitions includes a dollar amount per child per year, which that still amounts to TBD, which those amounts are reflected as TBD. Additionally, for Title 5 centers, like Title 5 FCCs, the definition includes a wage differential for owners/staff required to support dual language learners. The differential is to be determined. And let's see here, our next slide. And now we'll review the non-personnel groupings. And so the definitions you see here are for the base rate elements consisting of administration, occupancy, education program, and operating reserve. For both Title 22 and Title 5 centers, the definition is the same as FCC. Administration/office, the element is meant to cover the costs, including but not limited to telephone service and vehicle expenditures. The definition consists of a flat rate per child. Occupancy, this element is meant to cover costs, including but not limited to mortgage/rent, home insurance, utilities, household supplies. The definition consists of a flat amount per child. And then education program. The element is meant to cover costs, including but not limited to education supplies and food. The definition consists of a flat amount per child. And then finally, the definition of operating reserves is a percentage of total expenditures for both Title 22 and Title 5 licensed FCCs. So let's go to the next slide. Okay, so as we covered last month, federal regs allows for us to have enhancement rates on top of the base rate as a way to increase payments for providers serving children with special needs and as a way to incentivize or to cover costs for higher quality. In its 2022 report, the Rate and Quality Work Group recommended that the state establish and fund the base rate before proceeding with the supplemental rate levels or enhancement rates tied to program quality or new requirements. It also recommended to retain the current weekend and evening rate enhancement. The three enhancement rates defined by the JLMC reflects three different kinds of additional expenditures or expenses of addressing specific family needs. As many of you know, our current system includes adjustment factors, which are multipliers used to augment the reimbursement rate for providers who serve children that meet certain criteria specified in the statute. How enhancement rates under the single rate system will interact with the current adjustment rates, we still have to continue to have conversation in regards to that. The next 3 slides will summarize the enhancement rates elements as defined by the JLMC. So let's go to the next slide. So for all home-based settings, the JLMC included an enhancement rate element for extended evenings and weekends defined as an adjustment factor that should reflect the additional cost associated with being open for non-traditional hours that adequately incentivize this care for settings where it's primarily offered. The JLMC also noted that further discussions, modeling, and research is necessary to see how this rate would be applied and how it would integrate or replace current extended hour requirements. We are looking for feedback today on whether this definition should be carried over to center-based providers or whether any changes are needed. So let's look to the next slide. We saw on an earlier slide that the JLMC made inclusions an element of the base rate. The JLMC added an inclusion element to the enhanced rate for all family childcare home providers. The enhancement rate inclusion definition for Title 22 and Title 5 FCC providers has 3 parts. It's a fixed amount per child/year for equipment and special materials. It's a fixed number of hours per week/child, and the number of children to whom the enhancement rate applies to is to be a number above the 10% of the grouping. We're looking for feedback today on whether any changes are needed in carrying out this definition over to centers, and really look forward to your feedback. So let's go to the next slide. And so finally, the JLMC created an enhancement rate for child transportation defined as a flat amount per child annually, separate from the vehicle expenses already included in the non-personnel. This element is meant to reflect the year-round transportation services between school and activities, children's homes and providers' facility homes when necessary to support families at their discretion. Such expenses may include things like business insurance, car seats, booster seats, and gas. So with that said, we're also looking for feedback today on whether any changes are needed in carrying this definition over to our center-based providers. Okay, so before I jump to the next slide, I'm going to turn it over to Gina to be able to provide some clarification in regards to some of the feedback that we have received in regards to what we have gone over.
Sure. As part of engaging deeper with centers in the process, we got just in the last 24 hours or so some feedback on this particular set of variables. And there are certainly some things in there that understanding some of the elements of the model that are baked into non-personnel, like child liability and general liability insurance, will be really important to clarify through ongoing center-based discussions. And then there's some other things that were raised in there that we really want to make sure that the costs are included. So things that are in Title V, like number of conferences and other family engagement activities, some of those are intended to be covered in the options of the selection points. And I think the exercise is to ensure that the center-based representatives really feel that all of the costs related to the different regulations they're meeting, particularly as Title V programs, are encompassed in how the cost model functions. So there's a little bit of getting to know the model better, and there's a little bit of a good discussion that can happen with some of the things that were raised and through that analysis.
Perfect. Thank you, Gina. So let's go over to our panel discussion. And so now we are at the panel discussion segment, and we're eager to hear from our panelists during this segment. Before we jump to the hand raise, we'll do a couple things because I want to make sure that also we get to everyone. So we know that we have, and while I was going through the slides, we are going to continue to comb through all the different comments that are coming in from the panelists on the chat, and make sure that they are part of public record too. And then of course, we'll then continue to do our verbal at the same time concurrently. So you might see me kind of look away because I just want to make sure that we are able to toggle between the both of them. So let's go ahead and turn it over to Donna.
Hi, everybody. Thank you for the information. I actually have two questions. I'm curious, and this is, I think, a question for Gina. Actually, both my questions, I think, are for Gina. Sorry. What are other states that have gone this route using as the base for their personnel costs for wages?
Donna, if you don't mind, I'll go ahead and jump in before the second one. Right?
Mm-hmm. That's fine.
So there are a couple different things, and just like all alternative methodology processes, it's not a single point of definition that usually states or communities in the case of District of Columbia are using. In the case of District of Columbia, they do utilize the BLS as a starting point to understand the current market for wages. As part of that, and they always have, frankly, but it always was with an increase to it. And part of that was at first they looked at what they had from where folks needed to go for a living wage and looked at the percentage increase to BLS and felt like that they were in a space that was an increase above what people were currently earning. They also looked at some current earning data and saw that they were a little higher than that. So in their case, they continued that pattern. They're also 3 cycles into modeling, so it's a different ball game, and they've seen an increase in their BLS, pretty significant increase in their BLS. So it's a different source for them than other communities because they've kind of changed that broken, right? To your point in the chat. In the case of in New Mexico, they used minimum wage as their salary floor, but for only one tier of their quality structure. And so that's an important piece of context because there's only a small slice of providers that are the salary structure and the cost model is at that minimum wage. They then increased it at all the next 4 tiers of their quality structure, expecting that people are coming more qualified. So that was just their floor kind of for one corner of their salary scale. And in the case of Virginia, Virginia used K parity, but they did take a percentage decrease on K parity and using that as the lead teacher salary. So they had to go down from lead teacher for an assistant teacher and then up the scale for other positions like assistant director and director.
Okay, thank you. That is helpful. And then my other question is, when you look at the total framework, I mean, I know in running childcare programs that the biggest part of your expense is labor. So I feel like maybe folks are tired of talking about this particular topic, but it seems like this would be a huge percentage of the total would come from this wage determination. So I guess I just want to go on record and say what I said in the chat, which is it alarms me to see a $20 per hour for an assistant teacher who's required to have some college education in a state where minimum wage for fast food workers is $20 an hour and they don't have to have any education and training. I mean, we are, as employers, competing, we are bending over backwards and making changes in our operations to try to get our teachers up to $25, $30 an hour because we can't compete. And it alarms me to see that number and to think that that would even be, I mean, the whole point of this was to get away from the market because the market doesn't work. And if we're using current salaries, that is the current market. So I just feel like it's problematic.
Thank you, Donna. We have Brandy up next, followed by Dr. Sanchez and Robin. Brandy, please unmute and go ahead.
I just want to say that I could not agree more with Donna's last statement. I have to say I'm a little discouraged by this. Actually quite a bit discouraged by this. This is essentially embedding inequity once again into the system that we were supposed to be developing to not do that anymore. And I do have a concrete question. So there's discussion about using the MIT calculator, living wage calculator to ramp up the wages. I don't understand if you're not basing it on that. How are you using the MIT calculator to ramp up? What is the formula there? Can you guys walk me through? Maybe this is for Gina. How can you walk me through how that looks? And I'm curious to know why are we not starting from a different living wage at MIT? I want an answer as to the why, because I keep getting this is what we're starting at, and I don't understand the rationales here. When given that we're supposed to be addressing inequity and addressing an undervaluing of our market and not using market to drive what we pay educators.
So
I can restate those if you want me to. I'm sorry. I'm a little
Brandy, thank you for your comment.
Frustrated.
So I'll have Gina start with the question in regards to the logistics for your second question, and then I'll jump over to your other question after that.
Got it.
So how it works in essence is, I'm going to use my hands, start with a column that is the BLS, and that can be for every single county, though the BLS is lumped, but we can find that $17 to $20 an hour that was on the slide a couple minutes ago. And then for those same places, what is the living wage? And then look at what the difference is. So if it's $17 an hour BLS, childcare worker position, what is the living wage to live in that
But
community?
what's the definition of living, like, what are you using to define living wage? Like the California living wage, like what?
Well, the MIT, in this instance, the
Okay.
extant source was the MIT living wage calculator for California. So it's, I mean, there's a specific, page in the tool that is California, and you can get a value for each county in California. And so then what we're looking at is how far the BLS value is from a living wage for the place, to then think about what the increase can be on the BLS to be approaching a living wage for the place that the individual lives and works.
And how are you getting those numbers if in the BLS there's only one childcare, that, like, it said something about there's only one occupation that's called childcare, and that's basically at the assistant teacher floater level? Is that what I understand?
Well, that one position is used to be the comparison between, so that is the childcare worker position that's being paid in that community, to compare it to the living wage in that community. But then that starts a salary scale. So the concept of BLS plus or living wage is that no one is below that floor that was established, but other positions are above it. That becomes the floor of it.
Okay. Thanks.
And in terms of your first question, let me start by acknowledging that that I hear what you're saying. That what you're saying is that based on having us have a drop down that includes other options outside of the MIT, embeds inequity in our system. And I hear that you're saying that and noting that too. So want to acknowledge that publicly, that you are stating that on record. And yes, the elements that we have now do have a selection point that includes all those. Again, we haven't landed on which one we're going to utilize, but I know that's difficult also to be able to think about when I continue to hear that, you know, that you are speaking in regards to the MIT. And so just, again, I'm just acknowledging what, you know, what you're saying, and want to make sure that I am noting that down as continuous feedback for us to continue to take back.
Thank you. I'll yield to the next set of group.
Thank you, Brandy. Dr. Sanchez, please unmute and go ahead.
Sí, muy buenos días, doctora Lupe, compañeros, panelistas y todo el...
Good morning, everyone, and all the public that is here today.
Yo ahorita me encuentro bien.
I'm very worried right now because the discussion that we're having today, and it's focused on these child home centers, and this should have been done with the GLMC, and it should have been done with us, with all of us. So why? Because the method all this cost should have begun on July 1st on 2025. It should have been done before. There's a lot of work that we still have to do, and the timeline should adjust to this so that this can happen. In other words, I think it's taking too much time, and we need this to happen. And I also have another question. This is my observation, but I have a question. What is your timeline to develop the factors that are going to be used to develop the cost of the home care centers? So that's my observation, and that is my question. Thank you.
Krista, I always have the translation off, so I want to just make sure that that what was said by Dr. Solia, I'm going to respond to it in English, and she could hear the response in Spanish.
Yes, she can. Sorry, I was on mute.
Okay, perfect. So couple pieces that I want to acknowledge based on what Dr. Solia had said and buenas tardes. So first is that observation that she's putting on record is the need to have the concurrent conversation with the centers at the same time as the JLMC. And so just wanted to make sure that she calls that out. The second piece that she says is that this is taking a time, and that's concerning in regards to having, this implemented sooner than later. And then the last comment or question for us has to do with the timeline. And that's the part I want to just make sure I captured this right, Solia. So your question is in regards to the timeline for centers regarding the selection points of when those selection point decisions will be made. I just want to make sure I captured your question appropriately.
Sí, correcto.
Yes, that's correct.
Perfect. All right. So in terms of the timeline for the centers in regards to when the selection points are being made, then with that is going to be a process that we're going to continue to have. So I want to first say that it will not land today, right? This will continue to be conversations that we're having ongoing for that. I'm looking for the team to just remind me of that timeline. And if I don't have it immediately, I will circle back to make sure that before this meeting ends that I can provide that timeline to this group. Krista, let's do this for this. So I'm going to leave that as an open question for me to answer before this segment is complete. And let's go to the next panelist.
Great, thank you. I just want to acknowledge the order. We have Robin up next, followed by Horace, and then Eric S. and Eric P. So Robin, please unmute and go ahead.
Hi, everybody. So yeah, I share the frustration that you've already heard from Brandy and Donna. This panel, it's my understanding, as well as the work group, that we're charged with coming up with the true cost, not what we can afford, not what is the market, but what is the true cost. And so I think if we were to take a vote of the panelists and listen to the public, and this is not the first time you're hearing this from me or from everybody else, we're talking about presenting the true cost. We should do that in our report. And then it's up to the legislature and the administration to say, thank you, that's the amount, or lowball it. This really reminds me of many years ago in San Diego. We got a grant and then county gave some money for quality preschool initiative. If we have a certain amount of money and we give the centers a supplement on top of their base rate from the state, what would that amount be in order to prove quality? And we came up with that amount. We had a market survey done. We did exactly this. And then the County Board of Supervisors said, well, we need to serve more children, so we're not going to give that amount. So quality was never able to be proven. So this is what's happening here. It's like, we just need to decide. Like, I don't think there should be choices. We said that we were charged with what is the true cost, and that's what we need to present. And then find out if there's money to pay it. Don't start from the bottom. Thank you.
Thank you, Robin. Horace, please unmute and go ahead.
Good morning, everyone. So we are all on the same page here today. Ultimately, we're talking about the early education of the child care process. We're not divided, but this whole process feels like we have been divided due to the fact that CCPU has been strong in being able to represent the child care home base. But at this point, we are talking about the early education, and that involves all of us. And we are here collectively talking about what this model looks like. And as everyone before me that spoke, Rob and Brandy, Zola, Donna, we're all talking about the option of what we spoke about in the first work group to this advisory panel. We understand that this is an option, and this public sector is to give narrative to the center base so they can have their voice. But we're now voicing and vocalizing our frustration and our ideas of what this is supposed to be like. We understand the true cost of care is there. It has been there, demonstrated. But what we know is it's astronomical. Let's put it that way. It's astronomical. So we have to make sure we put it out there. So this is what the true cost of care. Now, how are we going to get that paid through the legislative, through the administrative of California? But my point is, just like Zoya was bringing out, we're not divided. We need to stay strong, stay united, because we're all here talking about early education. And it's not about the home base where the CCP, us at CCPU, we've been able to have a JLMC. We talk about this. And a lot of stuff that we're talking about now, we're now reviewing here at this meeting. And this is why it feels like we're wasting time and we're not going to meet the July 1st, 2025, because all of us are benefiting from the things in our last contract that we have, enrollment by, getting paid by enrollment, being able to have the subsidy pay. This is important because those abilities of having that subsidy will end in 2025. So the deadline is we're going to fall off the cliff and we're going to have what to look at. And just like Brandy said, Robin said, here's a situation where we are now talking about other states who have done it. They didn't have the voice that here in California has. We're active. We want to make a change. We're tired of seeing this. And my point is, why do we have $17, $18 an hour where we're competing against the fast food industry? And I'm not saying lower the fast food industry. We're in the 5th largest state. We should be concerned that we're talking about anything under $25 an hour. And that's across the board. I get it. We're not talking about a dollar amount because right now, these CCPU, we're going to go back in the fall and negotiate and have a collective bargaining process about the final rates. But collectively together, you have all of us on this panel, and you have the public listening that's going to have their input as well. We're here to make a difference and stand at the point where we say, we understand that this is a true cost of care, and we have a timeline that we want to adhere to. Thank you.
Thank you, Horace. Eric Sonnenfeld, please unmute and go ahead.
Good afternoon, everyone. Thank you for joining us today. I have 2 questions. One, I think, is for Gina. This is a ticky-tacky question related to other states. So in their cost modeling and whatever rates they developed, what percentage of that base rate that was created was salaries and benefits? So, for example, what weight does salaries and benefits play into whatever rates were created in other states?
Well, I mean, it's going to depend, but typically between about 60 to 70%. You're sort of saying if we take what salary and benefits are of the cost and then compare that percentage to what the rate ended up being paid, how much did salary and benefits end up being? I mean, a larger percentage than what they were of the cost if you just take that and transfer it over to the rate. Otherwise, we kind of think about it as that the rate is paying a proportion of everything that the provider needs to pay for.
Right. So what I was trying to illustrate is the importance and why we're spending so much time talking about salaries is because it, like Donna said, is the primary, and what Brandy said, is the primary driver of whatever the rate would be typically. And this more is maybe a Dr. Lupe question is, who are the decision makers for the center-based choices? I know the JLMC has their process related to family childcare homes and exams, but who is the decision maker on the inputs into the cost model for the center-based calculators? Is it this group or is it somebody else? Or
So this group serves as advisory. It's an advisory panel that informs both the legislator and the administration in regards to these decisions.
Okay, so Lupe, hearing that the ultimate decision making is essentially a negotiation between the administration and the legislature as part of the budget process. Is that what I'm hearing?
That's correct.
And lastly, I want to put a plug into whatever base we're talking about, BLS, BLS Plus, MIT, living wage, or whatever else. And the idea of cost indexing for high and low cost areas. Cautionary tale for low cost areas, assuming it costs less to operate there, that exasperates the childcare desert problem, is because assuming it costs less because of a market factor there, you can't really bring that into a system that really should be deemed as infrastructure, not the typical business model of supply and demand, right? So we kind of have to make sure that we factor that in, and make sure whatever the base is high enough in quote unquote those low cost counties. So I'm just concerned when we talk about low cost counties that we don't perpetuate the whole childcare desert thing, because they may need more money than what it actually quote unquote costs them to be able to create capacity in an underserved area. Thank you.
Thank you.
Thank you, Eric. Eric Peterson, you can unmute and go ahead. And Robin, I see you next.
So many Erics. Good afternoon, everybody. First of all, I want to echo the sentiment of the work group around the rates. And also wanted to thank the advocates in Every Child California and the people who helped very quickly and kind of heroically put together all of the center-based stuff for the group, for the work group, because it was a lot of work to put all that stuff together in a short amount of time. And I just want to remind people that we had a regional market rate. I guess we still have a regional market rate process that I believe originated in the 80s and marched all the way till 2008, every single year producing a survey, which was inaccurate. And if you ever read it, they averaged 250 pages long that nobody could ever possibly comprehend. So I applaud the work group for trying to make it understandable to people, the process that we're going through. But what I would say is every March or spring, that report was presented to the legislature looked at it, and they made a decision on rates on the regional market rate based on the state budget and not on what it costs to do childcare for family childcare, home center-based programs and exempt childcare. And so we often got cuts or froze based on the state budget, not on the cost of doing the childcare. And it ended up putting us here, which is pretty much a devastated and completely broken system. And so what I'm kind of seeing now is a little bit of shadows of that creeping back in. And what I would echo is it's essential that we put the true cost of care up, what it really costs to do care, and present that to the legislature and remind them that these people that are caring for our children are really the foundation for all the workers in the state and all of the how they're going to succeed in K-12 education. And it's absolutely essential that we start making decisions like a civilized country based on what our providers, children, and families needs, and not what the state budget looks like. And I know that's a little naive, but I just want to put it out there for everybody because we're going to have to advocate very hard for this given our current budget situation. And so I need people to, like stay strong and advocate for the greater good, not the bad budget. So I guess I'll just stop there. Thank you.
Thank you, Eric. Deborah, I see you next after Robin. Robin, please unmute and go ahead.
Thank you. Yeah, it sounds like we know we're an advisory panel now, like we've known that. So my next question is, it sounds like this advisory panel wants true cost in the report. So are we advisory to what goes into the report? Do we have the final say of the written report? Are we advising your team to hope that it gets in the report? Like, this panel obviously wants the true cost, doesn't want the choices. And so that is the report that should be written. And if it's not written that way, then what is our, who are we advising? So can you talk about the actual final document and whether or not that's going to be what you're hearing today, which is the panelists want the true cost. We don't want those other choices. And that's what we want in our report.
So the final document is the rate setting that will take place after this entire process ends, next fiscal year. And so what ends up submitting to ACF then is the final conclusions of the elements, of the selection points, of the of where we landed with rates and et cetera. And that's tied back to the state plan. What this group does is they continue to provide us as advisory information. I know legislators are also listening, as well as legislative staff are listening to these conversations. And so you're also informing them in somewhat in regards to what the group is wanting to provide input on. And then, of course, we want to make sure we continue to receive public information too.
So I don't think, thank you, Lupe, but I don't think that's my question. So I understand that whatever the rate ends up being has to come from the legislature and the budget process. But we want this report to show that we recommend that we use the true cost. If you can't afford it, then you tell us that. But we want the report to be written the way we want the report to be written, not based on what we think the state can afford. So to me, that's a difference. I don't know, somebody else want to chime in, but to me, that's pretty critical. It's the same thing that happened in San Diego with the let's prove quality. Like, no, they did not prove quality because they just served more children and lowballed the amount that the centers got. So we need to show what the rate should be, and then somebody else can decide if they can afford it.
And I'll just hop in quickly because and I'm sorry to jump ahead of you, Deborah, but we're not doing the rate setting here. We're just setting the policy. So I guess I am concerned that we're using current rates to set the current wages to set the policy. The policy should be the vision of where we want to be, with full understanding that the rate setting will come later based on what can be paid for in the current state finances. But the policy vision should be larger. It should be visionary. It should be compensating people equitably based on cost of care, on the cost of care and on living wage. And I think it's important to make sure that those numbers get tabulated and that they're public and that they're out there so that we know over the time it's going to take for us to get there, we have a clear goal. But if we water it down at the very beginning by tying it to current wages, we'll never get to where we need to go.
Thank you, Donna and Robin. Deborah, please unmute and go ahead.
Thank you so much. Good afternoon, everyone. I'm out here at a junior high doing pickup, and boy, am I enjoying this heated discussion. I love it. I appreciate it. I'm glad that we're here. I'm also happy to hear that the state is going to be meeting with the centers and in a work group, and I can only imagine how long it's going to take, you guys, because there's a lot of hard work into doing this, and it takes a long time. So with that being said, I'd like to know a timeline. What is the state's timeline frame for developing the factors that will be used in developing, the cost of care for child care centers? I respectfully heard you say, Dr. Lupe, about the TBD, to be determined. I respect that, but we want to know, give us a little bit more meat on that bone. What is the timeline that you all are expecting? Because at this point, we're getting set back further and further. And as Horace had mentioned, he said about providers falling off the cliff. Come July 1st, 2025, you know, providers are not gonna, people are not gonna be receiving that per child payment or even based on enrollment and not attendance. So there's another worrisome coming on with the fact that we're having setbacks here at this point with the timeline. So, you know, we like to know what the true timeline is, a realistic timeline, and if we need to go back and extend the payment per child, then that's what we need to do until this is completed based on a commitment that was made. And that's my 2 cents. Thank you.
Perfect. So let me jump in with the timeline because there's different pieces with this timeline. So first, in regards to the center, right? So for fiscal year 2024-25, the finalized selection points for each variable in the cost model. Selection points will be determined during the rate setting negotiations between CCPU and the state, and input from center programs and other unrepresented stakeholders will be gathered through this parallel public engagement process. So I want to remind everyone what we have in the MOU, though, which will is also calls this out specifically. So the timeline for the home-based providers is governed by the MOU, which says within 90 days subsequent of ACF approval of the single rate structure utilizing the alternative methodology and the CCDF state plan, the parties agreed to reopen that agreement for good faith negotiations to the restructure of the current subsidy reimbursement rate and the associate funding to be applied to family childcare home providers consistent with the ACF approval for a single rate structure and the implementation thereof. Please know that as I'm reading this and understanding that there is the 90 days of approval, et cetera, there's a lot of work that we still have to do leading up to this, which I would reference as pre-work. For example, as part of this conversation, there were some questions that we proposed in regards to the elements that talked about these enhancement rate elements, transportation and et cetera. And we posed some questions and would really love to hear from the centers regarding whether that makes sense, whether it doesn't make sense, and how else we can think about those enhancement rates. And so if we could spend some time, because I am worried about moving to the next segment without capturing some of that type of feedback from the panel. So I'll stop there.
Thank you so much, Deborah. And hearing the reminder of the questions posed from Dr. Jaime Milam, we still have open floor for panelists if anyone would like to raise your hand and provide feedback on those 2 areas. Eric, please unmute and go ahead.
So looking at the slides, as far as the TBD items, are we supposed to be trying to help Gina and P5 figure out what additional costs need to be dumped into the calculator model as part of today as well? Building off the center-based meeting that was held earlier this week that Dr. Lupe mentioned, would that be somewhat helpful with our time today as well?
Yes, so feedback on what I just presented in regards to all the elements. And then I hear and Nit mentioning that I've received a lot of feedback in regards to the salaries MIT, and understand that that is definitely an area where, you know, I'm hearing a lot of feedback, but there is also other elements that we walk through, including the enhancement rates, that we would like to continue to hear any feedback from the panelists. And then of course, we'll open it up to the public also.
Thank you, Dr. Lupe. And this is more of a generic question, I think, for the P5 folks. In the other states, in their cost modeling, did they, or were you able to create a factor for doing the cost of doing business with the state. I'm not talking about the ratio requirements. I'm not talking about those basic regulatory pieces of dealing with the state. What I'm talking about is more of the administrative reporting, the divergence of two state control agencies, the limitation on suspension and expulsion in certain Title V environments. How are you able to cost model that in other states, if applicable?
Yeah, part of the input sessions and the discussion with programs are really critical to that because it helps us to understand how programs implement in response to those things. Do they have a additional administrative staff person in order to manage the different paperwork? Is there elements of maybe internal, I don't want to say a data system, but how they manage their sort of tracking and software to be able to report under their state contract? All those things, we're seeking out that sort of input from programs when we're engaged in those discussions to convert them into cost drivers in the cost model. And then part of the conversation is sort of vetting those through, like, here's where we landed on a staffing pattern to respond to being a Title V contractor. Does this reflect what program experience is? Do we feel like we're getting ourselves to that place of encompassing all of the different elements of particularly contractor regulations compared to just meeting licensing? So that is the exercise that we've been engaged in for a few years now, right, in the state of California, going back to 22, to really deep discussion of Title V compared to Title 22.
Thank you.
Thank you, Eric. At this time, noting our time, we want to make sure we allow time for public comment. So we are going to move into the public comment period. We would like to hear, oh, sorry, Dr. Jaime Milam, I believe you wanted to share directions on public comment from slide 26.
Yes, thank you for that.
好了，谢谢。公共的意见，我想要提醒大家，我们现在开放聊天室，还有屏幕的直播来让大家发表意见，但是我们要
in public record for this time. And I will now turn it over to Krista.
Thank you, Dr. Milam. Just want to note we had a little technical glitch there and the Chinese translation was coming through on the English channel. So we may need to repeat that, please.
So checking, do you need me to just provide? Okay. Perfect.
Yes, can you go ahead and say that one more time? Thank you. Apologies.
Yes, no worries. So we are now open to public comment. As a reminder, we will be keeping public comment to about a minute. We do have a timer. And please know that because it's public comment, we will not be responding to questions, but taking everything as public record. And so appreciate everyone's time, and I'll turn it back to Krista.
Thank you. So at this time, we are going to open chat, as well as open the opportunity for members of the public to raise your hand if you would like an opportunity to give verbal comment. And again, respectfully, we will be using mute to end public comment after 1 minute. If that does happen, please do continue your comment in chat. Both the verbal comment and the chat comment are recorded. And I see Sarah Baches. Please unmute and go ahead.
Good afternoon, Sarah Baches with Children Now. We want to reinforce the importance of ensuring that this methodology, which is currently not provided ahead of meetings for public consumption and evaluation to provide concrete comments, that we still continue to believe that it needs to be based on a cost-based reimbursement model with a transitional plan that accounts for livable wages and true cost of childcare that is aspirational, equitable, and aligns to creating parity with our public school system, ensuring that no provider and worker faces a financial reduction or stagnation in wages as we transition. And it also accounts for enhanced healthcare benefits and retirement contributions in alignment with the benefits that we provide our TK to 12 educational counterparts. It's important that during these sessions, we get an opportunity to see the modeling of how this alternative methodology will change rates to provide stability in the field so that our families with children meet the services that they so desperately need. And this, unfortunately, is not a consensus of the field.
Thank you so much. And again, if you are not able to complete your comment, please do add to chat. And a reminder, I know this is really difficult to balance with a 1-minute time limit, but we do have simultaneous translation. So if you can speak at a moderate pace, please do so, knowing that we record chat as well as verbal comments. So with that said, Serena Lynn, please unmute and go ahead.
Hi, yes, Serena Lynn. I just wanted to, as a mother of a 4 and a 7-year-old and someone that's been in the field for I think over 10 years now, really proposing a rate for any early childhood education and care program that is not based on the true cost of care goes against the charge of this work group and this panel. It's written on the website that we are here to increase positive outcomes for children, families, early care and education workforce, and will be setting subsidy payments informed by the cost of care. Also, although the process, and I repeat, it's the process and not the people of the JLMC is somewhat convoluted, the field's input, I am so thankful that you can hear on this call that the ECE field, family childcare homes, CCPU, private providers, center-based providers all agree that rates should be based on the living wage and the true cost of care. Thank you so much for your time. It's hard to, yep, I'll put it in the chat.
Thank you, appreciate that. Marcella Graves, please unmute and go ahead.
Hello, yes. Hi, everybody. Good afternoon. Can you hear me?
I can hear you now, yes.
Okay, great. Yes, I wanted to also state that it needs to be the true cost of care, and until the decision also need to extend. We have implemented the piece of the 140 per child, that should be stabilized until we come into agreement with that. And also think about all the providers, home base, that are really working hard and working in their communities to keep everything going. Thanks so much.
Thank you, Marcella. And if I could ask, your speaker was cutting out a little bit, so we may not be able to capture you completely in the transcript. If you don't mind,
yes,
your comment to chat. Thank you so much.
Thank you. I was just saying true. I was just saying stay true cost of care and also extend it and the increase until they make a decision on the rates.
Heard that. Thank you, Marcella. And the chat continues to be open. And we have a few more minutes for verbal public comment. Not seeing any hand raised. Again, this is an opportunity. Please raise your hand if you would like to share verbal comment at this time. Celeste Salinas, please unmute and go ahead.
Yes, this is Celeste Salinas, and I am the director at the Cal Poly Pomona Children's Center, and I would like to echo the panelists' concern regarding the personnel costs. First of all, the benefits being optional. All of my employees have paid vacation and paid sick days, and our health benefit cost anywhere between $35,000 to $40,000 a year. It is a huge chunk of our expenses. I want my teachers to be paid like they should be, and I want them to have the health benefits they should have. Already they work a full year versus working 180 days like our K-12 counterparts. And I believe this really needs to be looked at and addressed when we are making these decisions. Thank you.
Thank you. Would any further members of the public care to offer verbal comment at this time? Seeing none, we can wrap up the verbal comment period, but we will keep the chat open through 2:32. So another few minutes for you to add your comments into chat. And let me queue up our share screen. I believe, Gina, we are over to you.
So I was just going to quickly take us through a reminder of some of the content we covered at the last meeting, which was in regards to the Office of Child Care's offered flexibilities for states that have gotten approval for alternative methodology, and California falls into that category. As we discussed at the last meeting, the Office of Child Care's flexibilities letter regarding alternative methodology came out in August of 2023, and that entities that are pursuing alternative methodology could request an extended timeline in order to finish that process, or for what reasons the state determines they may need an extended timeline. So California is pursuing these flexibilities in order to extend the timeline to better align with the budget and legislative timeline for the state. There are two things that have to be submitted as of July of 2024 with the rest of the federal plan that the state of California is submitting, and that is a report on the progress of alternative methodology, and then also an analysis of how inflation has impacted the rates paid to childcare providers. So as I mentioned, that gets submitted with the July 1st submission of the Child Care and Development Fund plan. The first part on the report on progress includes detailing all of the activities of alternative methodology that have been completed, which is actually all of the major activities of alternative methodology. So we are able to report to the Office of Child Care that California has carried out all of the activities of data gathering and model building, and that it is at more of the stage of the rate setting that the state is moving into the new year on. To go to the next slide, we can take a quick look at the analysis of the increases. So the request from the feds was to understand the impact of an in-state inflation. So using the average inflation rate for the statewide inflation rate for California from period of January 1st of 2022 through December of 2023, which was 11.2%. That period was selected in relationship to when rates were last set. So the period that inflation would apply to is from the moment there was new rates that were set effective January 1st, 2022. And so we begin looking at inflation from that point forward. And that's where the 11.2% inflation came into place. And what the feds are ultimately asking of states that pursue the flexibilities is to analyze those rates that were set and submitted as part of that 2021 process compared to the inflation that has occurred over the last several years since that plan was submitted. And so for this process, in order to do this analysis, there was really the 11.2% was considered as the increased inflation that you would see upon your rates. But what we then were looking at is where rate increases had occurred or payment increases had occurred for programs in the state. And so there was two areas of increases in payments to programs: the cost of care plus rate and the transitional payment rate that providers were able to access. And so looking at those dollar amounts and comparing how much they were in comparison to the rates available to programs. You see below on that table at the bottom of the slide, the average increase based on the age of the child that a provider saw because of the cost of care plus rates and the transitional payment rates. And so ultimately what we're attempting to do in responding to the federal request is demonstrating to them that there were increases upon that payment rate from 2021 that do equal or exceed the 11.2% inflation, statewide inflation that was seen in the state of California. And so in that, all three types of care: family, child care, family, friend, and neighbor, or trust line providers, and then center-based care. There are three different age groups for children. Infants are 0 to 2. The child age group is the 2 to 5 or before entering school age, and then school age is children that are receiving typically before and after or during breaks from school care from their child care provider. And so you can see how the average increase from the cost of care plus rate and the transitional payment rate that was made available to providers, what impact it had on the prior rates that providers had access to for those different ages of children in different settings of providers. So this is just a reminder of the inflation analysis process. And then that note on that as part of the plan submission, there's also a review of all of the progress of the alternative methodology process that gets submitted in making a request of the feds for exercising these flexibilities. And that will all be submitted, as I mentioned, with the July 1st date of plan submission. Turn it back over to Krista.
Thank you, Gina. And so now we are done with this segment of the presentation. And so we are now turning it over to the panel to provide us any questions in regards to the inflation rate analysis or any comments.
Robin, I see your hand raised. Please unmute and go ahead.
Thanks. Is it possible to put the slide back? Thank you. So my question is, if this is what happened as far as increases, is this the permanent increases or does this include the one-time only? Because if it does include all the one-time only that's been given out since COVID, I would not consider those increases. So I'm just curious if the one-time only was taken out.
Robin, it's Lupe. Let me clarify which one-time only are you referring to? We had quite a few. So are you referring
there was
to
a
the
lot of
stipends?
money that's still coming through.
Okay.
Did not increase our contract. So we call that one-time only money. The state calls it one-time only money. Stipends.
Got it.
I can't remember. There were so many different pots of money that would fall under one-time only. That is
got it.
Something we didn't know that we were going to get the following year. It doesn't increase the contract. Then there is some money that did increase the contract.
Got it. So
if it's ongoing, that is a true increase. If it's not ongoing, then that shouldn't be in here.
So in terms of stipends, the one-time stipends, those were not included in this cost of care rate, analysis. And Gina helped me to jump in, but this included both the current rate that you are receiving from the state in contract, and what is included that is out of contract is the cost of care plus rate is also included there. Let me pause and see if Gina would like to add anything else to that.
Yes, the cost of care plus rate, I would say the transitional payment is a one-time that programs received, but the cost of care plus is happening on a routine schedule.
Does the cost of care plus expire? Then I wouldn't consider it an increase. And I don't know about everybody else, but it's a one-time only, just called something else.
So it is included in there. It is a monthly payment for your current to augment your additional rate. It does end at the end of 6/30 of 2025. And that's where we'll have the legislative process, the budgetary process kick in to see what happens after that.
I would just caution you because if, let's say, no increases happen after 2025, then your next report's going to show a decrease. And I don't think the state wants to show that. Because the cost of care plus does expire.
Thank you, Robin.
Thank you, Robin. I see Eric Sonnenfeld, Eric Peterson, and Donna. Eric Sonnenfeld, you're up next. Please unmute and go ahead.
Thank you. I want to echo what Robin had mentioned, but I have another question on this analysis, the regional market rate. To me, this feels like a feel-good process because it's a percentage on top of the broken regional market rate system. So yay, we increased it by 11% or whatever with all these one-time processes, but the RMR is already inadequate. And that's the purpose of this whole process. So I'm not quite sure, other than we have to do this because it's a federal requirement, check the box kind of thing. Personally, I don't want to spend too much time on this because this really does not inform any of the process. We need to spend the time on talking about the new rate structure because this is just saying we increased money on top of a lower base number than we started with. Am I understanding this correctly? Or maybe I'm off base.
No, you got it, Eric. This is a request under the federal offer of the flexibilities. They asked for two things from states: a report on progress of alternative methodology and an analysis of the inflation related to rates. And so that's all that this is just answering that question, which is a unique question that they asked. It's not something they've asked you before, to consider your rates in relationship to inflation. So it is without teeth related to the overall alternative methodology process.
Thank you, Eric. Eric Peterson, please unmute and go ahead.
Well, this chart did make me laugh a little bit. The feds, so I see it as an opportunity for you to respond, because this was for January 2022 through December 2023. And everybody on this entire phone call knows that the inflation rate for starting at the beginning of the pandemic up until December 31st of 2021 was probably 5 times what it was last year. And so, yay, we got a little increase based on temporary rates, but I would kind of like to see you guys put something together that showed the inflation that started with the pandemic, because that devastated family child care homes and center-based programs. Just the inflation alone, not to mention all the other stuff that went on. So I just kind of wanted to say that. I was a little comical, but I see it as an opportunity for whoever's writing up the response to put in a little bit fuller response.
Thank you, Eric. We have Donna, Horace, and Robin. Donna, you are up next. Please unmute and go ahead.
Hi, I think I'm going to echo a little bit what Robin said, which is I'm concerned that we baked the Care Cost Plus stipends in as part of the rate. They're being contracted out separately, they're being treated separately, and they don't really allow people to raise wages for their workers because they aren't something that's sustainable, which is what we said at the time they were implemented. And I don't know what the numbers are behind this, but I'm guessing a good part of the percent increase is those short-term stipends, and that the ongoing base increase is well below 11%. So it seems sort of disingenuous to me to frame this as an increase that everybody got, because it's a short-term fix. And it just concerns me that we would put that out there, even in a report to the feds.
Thank you, Donna. Horace, please unmute and go ahead.
I'm baffled by this process, and I understand it's requested, but now we get to give a response. Hopefully the response is documented. But basically, this, just like Eric said, it's a situation where it's a Band-Aid on top of a Band-Aid on top of a Band-Aid, that this whole regional market rate was a shamble. And we were in dire deficit due to the pandemic, but prior to the pandemic. But due to the pandemic, we were acknowledged as essential and we were here to help. So financial means were coming about our way to help us. And now they're coming at as an increase. I laugh because it's not sustainable. It's barely giving us opportunity to breathe. You know, again, I don't want to go too deep into it, but just as everyone else said, this is not a continuous process. So there's a definite date where the edge we're looking at for this supplemental rates that we are receiving, but still that's not enough. What is providing for true cost of care. Thank you.
Thank you, Horace. Robin, followed by Deborah and Brandy. Robin, please go ahead.
I'm hoping by the fact that this is being presented to us, that there's still an opportunity to correct this, because what we're hearing is that it's misleading and not accurate. And even though it's a report as a response back to the feds because they requested something, this is going to be looked at by our state legislature. So they're going to be like, you guys are good. You got a 15% increase. Why are you asking for more money? And so the question is, can this be corrected to show what increases are permanent based on the contracts versus the trend, the one time only?
Thank you, Robin.
Yeah, so this particular topic in regards to how the methodology was used and this question itself is connected with the ACF asking for us. So therefore, that's why we're reporting it out in such a way to make sure that you are aware that we are putting in there the cost of care plus, as well as based on the regional market rate. I know that the legislator, as you mentioned, is tracking this information, and we, the administration, are also tracking the information, and know that that's a separate conversation in regards to the true cost of care and the alternative methodology. So this is just simply the report that we need to fulfill with ACF based on the specific question that we're reporting out to this group.
Right, but the cost of care plus rate, nobody knows what that means. It's temporary money. So maybe if you want to put in parentheses temporary funding, otherwise it looks like we're good and we got a lot of increase. Temporary was the word I think is in all of the management bulletins. So it just looks like a rate increase, which it's not.
Thank you, Robin.
Thank you, Robin. Deborah, followed by Brandy and Dr. Sanchez. Deborah, please unmute and go ahead.
Yes, thank you for that. I won't beat this horse over the head. I just want to add to it. If you're going to leave that line of the areas of rate increases, et cetera, then you need to put a truth footnote on it. You need a footnote there, and at the bottom, let's tell the truth on it, on how it was really given and where it really lies, and the fact that it is ending. So if you're going to leave it, I think that it should have a footnote, and I'll call it the truth footnote of what's really going on and what it really means. And I think that's fair to put that in there. Thank you.
Thank you, Deborah.
A footnote of explanation, all right.
Thank you, Deborah. Brandy, please unmute and go ahead.
Can you hear me?
Yes, we can hear you. Oh, but I think we may have just lost you. So we'll watch for you to log back in and we'll move over to Dr. Sanchez. Please unmute and go
Wait,
ahead.
can you hear me now? Can you hear me now?
Yes, I can hear you.
Okay. All right, I'll make it quick. I just have a question. So my understanding is you have to submit this 11% inflation information and the report on process and progress in order to get the flexibility that you want to extend the implementation of the rate. Is that right?
So California already has the flexibility because we meet certain criteria to receive the flexibility. And the flexibility, what it gives us is to allow us to go past the June 30th of 2024 of wrapping up the alternative methodology, right? So now in response to that we are, that we meet those, then there are certain questions that ACF would like us to follow up with, which includes this analysis to be included in that.
Okay, so if you've already been granted the flexibilities or been eligible for the flexibilities by nature of the state that we are, then why wouldn't we just promote the truth in what we're sending in there, especially since people have raised that the legislature will be looking at this? And I agree that anything that is sunsetting at any point and has an established in statute sunset should not be included as a rate increase. So to me, there's no harm or foul if you've already gotten the flexibilities approved to be honest about where we are as a state with the rates in regard to inflation. Thank you.
Thank you.
Thank you, Brandy. Dr. Sanchez, please unmute and go ahead.
Sí, muchas gracias.
Yes, thank you. What I feel is that what we're seeing right now is that I'm worried that this be reported to the state because I don't think it's real. It should be adjusted right now to the inflation that we have right now. All the providers that we're having this inflation, and like Deborah said, we should submit it, but with a footnote to say what happened here, because it's going to include all the stipends that we received, and that's why we can see that there's an increase in the rates. So that's what I think, that is what I think, that we shouldn't include a footnote and this be submitted in a way that it's not an actual increase, because it's including all the stipends that we receive, and that these stipends were only temporary. Thank you.
Thank you, Dr. Sanchez. Horace, followed by Eric. Horace, please unmute and go ahead.
Yes, I want to just add a brief little, the one-time payment that the home-based providers received was in November. So I can't tell if it's listed in there, but the cost of care didn't start until January. So it kind of is disrupting when we see January 22nd through December 31st of 2023. It just doesn't meet to the realization of what's going on. That's all I just want to add. Thank you.
Thank you, Horace. Eric Peterson, please unmute and go ahead.
Yeah, I'd probably be my recommendation that you take out any of the temporary ARPA funding out of that and put it as the original rates, and then the footnote being, we also got some temporary money in here, but that's all gone now and it's all expiring. FYI, I mean, I really think you should flip it, but not include any of those temporary things that we got that are not ongoing. And the footnote should be, we also got some here, but it's all gone now.
And just to clarify, this analysis does not include any of the ARPA temporary one-time payment, right? It only includes the analysis of the regional market rate plus the monthly cost of care plus rate, which we can put on there a footnote that sunsets or that's an agreement as of a certain period of time. And then, of course, Gina double checking with it, but the transitional payment is also put in there, but referenced as a one-time.
Thank you, Robin. Please unmute and go ahead.
I think it was Eric that just brought this up. So the dates, or maybe it was Horace, that the cost of care plus. First of all, thank you, Lupe, for editing this chart. So if we take out the cost of care plus, because that didn't even start until recently, then will those percents go down?
So we would still include the cost of care plus, but I think what I'm hearing is us being able to add more language in regards to that has a final end date in regards to that. So as referenced, not so much a footnote, but part of the narrative piece.
But I guess my point is that with this, and if this chart is to December 2023, did the cost of care plus start in January 2024? So it's even with a footnote, the whole thing is confusing and misleading.
Thank you, Robin. Deborah, followed by Eric. Deborah, please unmute and go ahead.
Oh, thank you. Thank you for that note also. You're right, it didn't begin until 2024. But as I'm sitting here looking at this, as far as regional market rate increases, let's just be for real. It was 2018 to 2022. I just leave 22 as it is, because that was the last time. Instead of trying to make it look like there was more money put in or there was some sort of increase, I'll go back to that good old word, the truth. Because the truth is that that was it. 2022 was the last increase, with the exception of 2018. We have to stick to the truth, even though it's something that has to be submitted, as if it's just something that has to be done. Let's submit it with the truth in there as a footnote or whatever the case. But you're right, it didn't happen until January of 2024. Therefore, it shouldn't be included as far as that cost of care being included in this. So a lot of points, everybody, and truth is what we're looking for, and it's not happening here. Thank you.
Thank you, Deborah. And final comment from the panel before we move into public comment. Eric, please go ahead.
Thank you, Deborah, for your comment. And I'm not quite sure if this is the actual form that is put into the federal document or not. I'm assuming not. But and I don't know what the form actually looks like, if there's additional spaces to put things, if we need to indicate the whatever one-time payments we're going to include in this percentage as a visual, not only to the feds, but to any policymakers here locally, we need to show that. A footnote, I don't think, is enough, because most folks are visual learners. And I'm not going to read that footnote. They're going to look straight at these percents and move off. So I would like a visual footnote showing the differences. So if we include the one-time payments on top or whatever, it's its own separate percentage and a total. So we can actually dissect all of this information. And as Deborah mentioned, we're letting the truth speak for itself. So this is what California did. Let's go back to the 2022, last time the RMR was touched in California. Do that analysis, show the temporary increases the state had done either through ARPA or one-time payments through the general fund or whatever you want to call it, and showing those differences visually, not just in a footnote, because policymakers will look at this chart and run with it, like it or not.
Thank you, Eric. That concludes our panel discussion for this topic. We will move into public comment with a reminder again that we have a 1-minute time limit in order to promote accessibility for the maximum number of members of the public to comment. Please do consider the translators when you are offering your public comment, and know that we are recording both the verbal and comment that comes in through chat. So let's please open public comment at this time. And Serena Lynn, I see your hand raised. Please go ahead.
Hi, yeah, I think everyone has pretty much said it, but I'll just say it again. I don't understand why emergency funds that were necessary to keep programs operating that were one-time or limited time funding would be included in something called an increase. And I think when we talk to the feds and we talk to anyone in the legislature, we really need to show our story. And I don't understand the pushback about making this really show the story of early education and the funding that we receive. I appreciate Eric's notes. that it should be visual and the percentages should show the increase, sustained investment, not temporary investment and non-investment that's ending in 2025. And again, I don't understand the pushback about making that a real story and show what's actually happening in California. Thank you.
Thank you. Marcella Graves, please unmute and go ahead.
Yes, I just also were saying it should be like temporary. It shouldn't make it like it's like we got a raise because we didn't.
Marcella, I'm sorry to interrupt you. Your connection is unstable. We're having difficulty hearing you. We're not able to make out what you're saying. I'm going to go ahead and move on to the next person. And if you want to try calling in and see if you can get a better reconnecting to see if you can get a better connection, I will come back to you. Apologies for that. Lucia Gary, please unmute and go ahead.
Hello, good afternoon, everyone. I wanted to begin by thanking everybody who's been a part of this panel for this lengthy period of time and for your dedication to really speaking up for what needs to be happening. Comments on this last section, I completely agree with what Eric and Robin have been stating about having the chart speak the truth. But going back to the alternate cost methodology, several members of the public and of the panel requested for a timeline to make sure that the voice of the centers was included, and that has not received a response. So I would just like to see, as a member of the public, something be published regarding that concern.
¿Ya subieron, chicos?
For the public and for the members of the panel. Thank you.
¿Ya se sirvió?
Thank you, Lucia.
Okay, muchas gracias.
And I believe we may have a panelist that needs to mute. Alana Pinsler, please unmute and go ahead. Alana Pinsler, please unmute and go ahead. Right, looks like you've down. Tech support, could we do a quick mute all, please? Thank you. Apologies for that. Again, public comment is open for the next few minutes, so please do share your comments in the chat and raise your hand if you would like to offer verbal comments. And Marcella, I see in chat that you are back, so let's give that another try. Please unmute and go ahead.
Yes, can you hear me now?
Yes, I can hear you. Thank you.
Okay, I was just saying yes, and all that it does need to be stated that it's temporary funding, so they don't look like as if we got raises, because we didn't. It was just temporary funding. And I just want to say that. Thank you so much.
Thank you, Marcella. We have a few more minutes available if any other members of the public would like to offer verbal comment at this time. Zoila Toma, please unmute and go ahead.
Good afternoon. Good afternoon, everyone. Thank you, panel, and everyone that is involved in all this process. I know it's lengthy and it's been years trying to figure it out this. But like my question is, if this 11% is gonna close the gap for 6 years that we're behind, or this is something that we're just gonna continue doing over and over and over again, because it's very unfortunately what I see. The numbers doesn't reflect, and I don't see how this gap it's gonna close with 11%. That's what I see on the chart. I don't know if I'm misunderstanding anything. Please clarify that, and whatever the panel and the people that are speaking about, the educators that are speaking about it, yeah, numbers don't make sense. It's clear that we have to repeat ourselves over and over again because it looks like our voices is still being ignored in that area. So please, let's continue working. Thank you.
Thank you so much, Zoila. And time for one additional verbal public comment. If any member of the public present would like to share verbal comment, please raise your hand so we can allow you to unmute at this time. And thank you to those of you who are sharing your comments via chat. Please know that we do recognize and record comment that is offered through chat as well. All right, I am not seeing any further verbal public comment at this time. As this is the last public comment period, we will keep the public chat open through the remainder of the meeting. But if we can go back to our screen share, thank you. We will move ahead back to Dr. Jaime Milam. Dr. Milam, you are on mute. If you could go ahead and unmute. Sorry about that.
Oh, what about now? So are you able to hear me?
Yes, I can hear you.
Okay, perfect. So our final order of business begins with gratitude. Let's go to the next slide. The Rate and Quality Advisory Panel was convened in May of 2023. And 1 year later, it feels appropriate to pause and reflect on everything that has occurred during this time period. Thinking back where we started on May of 2023, California had not yet received a pre-approval from ACF to pursue the rate setting used as a cost-based alternative methodology. We had not yet had a successor labor agreement between the state and CCPU, which created the roadmap and timeline for our alternative methodology process. We did not yet have statutory language in the Welfare and Institution Code, which added metaphorically signs and lights to the roadmap where periodically and mandated reports to specified legislative committees. And we had not yet embarked on public engagement phase of the 2023 cost study, yet alone the data collection of more than 10,000 providers across the state. We had not yet built the California cost estimation model, and the JLMC had not yet defined the elements of the base and enhancement rates, which provides scaffolding for our single rate structure. Today, all these things have come to fruition. And I know based on today's conversation, we all can agree that there is so much more work to move forward on this. And through it all, the Rate and Quality Advisory Panel has played a critical role in advising and informing the state decision-making. We're deeply appreciative of that commitment of time that you have made and continuing to give us your direct thoughts in regards to this process for all the panelists, for the members of the public as well. And we look forward to our next steps, which will lead to rate setting under the single rate structure within the next 13 months. Now let's take a look next at what will happen between now and then. So just as a reminder that our alternative methodology timeline can be found in the Rate and Quality website. The last month, we covered the state submission of the information to ACF on July 1st of 2024. Looking beyond July, what remains ahead of us is rate setting and implementation. So on the next slide, I will provide more details and views of these milestones and understanding that we still have some work to do in regards to those setting those TBDs that we started to discuss today as discussions. So let's go to the next slide. So by July 1st of 2024, CDSS is required to submit 2 written deliverables to the Federal Administration for Families and Children, ACF. The first is the CCDF state plan for federal fiscal year of 25-27. The second is a letter requesting to exercise federal flexibilities related to the state plan timeline. and which were offered to the state like California that are transitioning to a cost-based alternative methodology and may be unable to complete all associated activities by July 1st of 2024. For more information about this federal flexibilities, which we discussed at the last month's meeting, we can be found on the Rate and Quality website. So by August of 2024, the definitions of the base and enhancement rate elements for the center-based programs will be finalized. I'll say more about this in a moment. And fiscal year 24-25, CDSS will lead internal and external facing implementation planning activities throughout the fiscal year. Such activities may include, but not limited to, development of regulatory and policy guidance, creation and delivery of training for contractors, updates to contracts, and reprogramming of data systems. And then within 60 days of approval of California's 25-27 CCDF state plan by the federal ACF, CDSS will submit an outline of implementation components for the approval of a single rate structure to the legislator and CCPU. Each will have 30 days to review and comment. Within 90 days of approval of California's 25-27 CCDF state plan by the federal ACF, the state and CCPU will reopen negotiations to restructure the current subsidy reimbursement rate and the associated funding, and to be applied to family childcare home providers consistent with ACF approval, single rate structure, and the implementation of thereof. And then fiscal year 24-25, we're going to finalize the selection points of each variable in the cost model. Selection points will be negotiated between CCPU and the state during bargaining. Input from center-based programs and other unrepresented community stakeholders will be gathered through a parallel process, public engagement process that will inform the state's position in bargaining. No later than July 1st of 2025, per federal guidance contained in the Office of Child Care Flexibility Letter, CDSS must set payment rates based on the alternative methodology by the state. Rate setting will occur for CCPU, represented provider and program types through the budget process, concurrent with and informed by rate negotiations for family childcare home providers. The governor and the legislators are the final decision makers. So for fiscal year 25 and 26, rates shall take effect with any other activities reasonably and necessary to implementation have occurred, such as regulatory and policy guidance, training for contractors, updating to systems, updates to contracts, and necessary data systems. Sorry about that, it moved down here. Okay. And the current elements include a recognition of quality standards. However, additional conversation on competencies, skills, and abilities will continue into phase 2 of rate reform, which will take place in the calendar year of 2025. More information will be forthcoming. Let's go to our next slide here. So as we progress through these milestones, CDSS remains committed to the transparency process with multiple opportunities for input. CDSS will convene quarterly public meetings on rate reform and fiscal years of 24-25, where input on specific topics from a diverse and represented group of subject matter experts is needed. The department anticipates convening the Rate and Quality Advisory Panel for discussions. In other instances, the department may convene a general stakeholder meeting to share out information and receive public comment also. The Early Childhood Policy Council continues to meet quarterly, and rate reform updates will be provided during those public hearings, at least held 4 times a year for fiscal year 24-25. And dates are typically in August, November, February, and May, but could be subject to change. CDSS, in partnership with the Department of Education, is convening 2 advisory focus groups comprised of center-based programs, one for Title 22 private centers, the participation into the state voucher programs, and the other one for Title V centers and the state preschool programs. Professional associations, advocacy organizations, and members of the Rate and Quality Advisory Panel who represent centers will be invited to participate. So the department anticipates that the focus groups will be convened as needed through the fiscal year of 24-25. Their initial purpose will be provided input to the 2 departments on how the JLMC approves definitions of the base and enhanced rate elements should be modified to reflect center operations. And we would like to bring that conversation to conclusion by August. This opportunity for center input is part of the mandatory public engagement state process, and the definitions are required to be subject to focus group feedback, will be reported out to public meetings on the rate reform. So other time limit focus groups will be convened as needed by the department for fiscal year 24-25. And that's to gather input from subject matter experts on specific topics related to rate reform, and before bringing them to a larger group public meeting for feedback. Topics are not yet finalized, but we include examples such as automation, changes necessary to support the new single rate structure, implementation, issues affecting state contractors and counties, or policy and operation issues specific to Family Child Care Home Educational Network. Finally, as a reminder that public comments and questions related to the alternative methodology and single rate structure may be submitted to our mailbox, which we have single rate structure at dss.ca.gov. And then before we conclude, I also want to take just a brief update on the evaluation activities. As we shared previously, the department retained the services of Child Care Trends to develop a framework for evaluating the new rate structure. And while the evaluation itself has not yet begun until implementation of the new rates, Child Trend is starting to design the evaluation process now to get ahead of this. So just as a heads up that you may be hearing from Child Trends in upcoming weeks as they start to reach out to participants in interviews or focus groups. So that's a new development that I just want to make sure everyone is tracking in regards to just some early work on this framework. So let me go to the final slide. And so that brings us to the end of our time today. I want to thank everyone for your honest feedback, for being able to provide us the input that we need, reminding that this is not the only time. As you reflect on the current slides that we provide and post, please continue to provide us input both through our mailbox or in these different settings that we had mentioned. All materials from the panel meeting are available on the CDSS Rate Reform website, which is on the slide you're looking at now. You can also scan the QR code to join the CCDD listserv to receive emails and updates. Thank you again, and we're going to continue to keep the chat open for 5 minutes at the end to continue to receive any further feedback or comment. So thank you, everybody.
Thank you. And this does conclude the meeting. As Dr. Jaime Milam noted, we will keep the chat open for a further 5 minutes. Thank you so much.